Good morning, everybody. Good morning, Robin.
Good morning, Joyce.
Hi, so this is Robin Martinez and Joyce Graff from The Powerful Patient, and we have a little presentation that we wanted to do with you about the coronavirus. I know everybody is concerned about this, as we should be, and we wanted to give you some hints for how to stay sane at home and be appropriately concerned, but not overly concerned. So this is a picture of the three of us. You can see Robin and Mike and me. Mike was not available this morning to join us. And let me just get back to the beginning of the slides here. Good. First of all, the main reason is don't panic. And there's a very good message from Dr. James Robb, a virologist, that's circulating around the internet, but it has acquired a few additions from different people as it goes around. So if you look on Snopes.com, you'll see Dr. Robb's original message. And the basics, the most important and credible things that he said is if you have symptoms like a runny nose and you're coughing up a little bit of stuff, you probably have a common cold. So don't panic too soon. The coronavirus is usually a dry cough with not a runny nose, but be sure to drink plenty of water. And water might include tea, maybe with some lemon, those kinds of things. They're good for all kinds of ailments. So treat yourself to a tea with lemon anytime you want to. Robin, any other advice?
One of the things that has been added to a lot of messages about coronavirus is don't drink iced drinks, drink hot drinks. It doesn't make any difference. Just drink. Cold does not hurt you. It does not hurt your throat. It does not promote the virus. Hot doesn't really do anything other than maybe make you feel a little better if you're feeling ill, but it doesn't matter. Just hydrate, just drink anything you can drink.
Right, that's the most important part, is to keep your systems operating well and stay nicely hydrated. So don't panic for sure. And also watch whatever you touch. They tell you wash your hands for 20 seconds because the virus can live on your hands for quite a while. Even if it's 5 minutes, a lot can happen in 5 minutes. So think about it. From the time you touch something, you could be carrying germs of all descriptions to your face, and your nose, and your eyes, and your mouth are all places where those germs could get inside you and start to be a problem to you. There are a number of little songs to sing. Happy Birthday was one of them. Somebody said if you sing Happy Birthday twice, that it takes about 20 seconds to do that. And Robin, you had a few other possibilities that you could sing to entertain yourself for 20 seconds.
Yes. First of all, when you sing Happy Birthday, don't speed it up. Sing it at the normal speed you would sing it to someone. And then if you get tired of that, if you have kids, you can sing the ABC song. Again, don't speed it up, just like you're teaching them. You can sing Twinkle, Twinkle, Little Star twice. You can sing the chorus of Jolene. And if you sing that at the normal pace, that will take you 20 seconds.
Very good. Yeah, there are many things that you could sing. The idea is just to hang in there for a good 20 seconds, and 20 seconds is really a long time.
It feels very long.
Yeah, it feels very long when you're trying to do that. It's not just the air, it's the droplets in the air. So if somebody sneezes, those droplets can travel about 10 feet before they drop to the ground or any other nearby surface. So you want to wash the surfaces as much as you can, and it will also last on fabric for several hours, but regular laundry detergent will kill it there. The main thing, though, is that pathway between touching something and carrying it to your face. That's the one to worry about the most. I wouldn't worry so much about scrubbing all the surfaces in your house. but certainly doorknobs and anything you're going to touch like that.
Especially things that you're going to touch after you come in from outside, and things that come to you from the outside, like when you open your mail. After you open your mail, dispose of the envelopes and wash your hands again.
So the flu hits us every year. So what's new and different about coronavirus? It's a new kind of virus. It's different, and we don't have any defenses for it. The other unique thing about it is that it's spreading very fast all around the globe, and that's why they call it a pandemic. It's everywhere, and it's an epidemic that's around the globe. The pandemic of 1918 to 19 was the last really horrible one that we had, but it's not the only pandemic that we've had in the last 100 years. In 1918, 1/3 of the world's population became infected, and 50 million people died, including 700,000 in the United States. But don't forget, at that point, we had no vaccine. There was no flu vaccine. We had no antivirals. We had no antibiotics to help with secondary infections, like if you got pneumonia as a result of this. Now we have all of those things to help us. But nonetheless, 10,000 people die in the United States every year from the seasonal flu. This one is new in 2020, and we have no defenses and no cure. But the doctors and the researchers are working very hard worldwide, and they're collaborating in an amazingly wonderful way that's new and different, much better than they've ever collaborated before, to learn how this thing behaves and what to do about it. One example that you'll hear in the press is that there's a recommendation out of France not to use things like Advil or ibuprofen if you have early symptoms, aches and fever, but instead to use Tylenol or aspirin. And the reason is that they've observed that this can sometimes worsen the symptoms. There are people who are in favor of that, people who are against it, because they say it's not proven. And it's true, we haven't had clinical trials yet to determine that. But nonetheless, those are observations from the people on the ground, and I think we should at least pay some attention to them. Robin, what are you hearing about things that you can do for symptoms that may turn out to be the cold or the seasonal flu?
Well, of course, you can always use things like Mucinex and cold remedies and Tylenol. Hot drinks are helpful in loosening mucus if you have mucus. There's lots of symptom relief that you can do. And don't forget, if you have a fever that refuses to break, take a cool bath. It'll be not that cold, but it should be enough that when you first get in, you feel like, oh my gosh, I'm freezing, because your body needs to cool down. And after you get in, you can just soak.
Right. And if you have that kind of persistent fever, you should probably be in touch with your doctor, right?
Well, it doesn't hurt to call your doctor, but don't go into a facility unless you are told to. Always call first. First of all, the facility might say, don't come here, go there. And they might say, when you come here, go to the south door, be sure to do this and that to get in. And they might tell you the sick people are coming in this door and the healthy people are coming in this door. They might tell you you can't have anyone with you when you come into the building. So anybody who comes with you should be prepared to wait in the car. And you can call them and tell them either, I'm being admitted or I'm coming out in half an hour, so that they don't just wait there interminably. You can have people go with you, but have them be prepared to wait outside.
Right. Very good. So let me go back to the slides for a second. This is a something that I picked up off the internet from the Center for Disease Control, and it shows the various pandemics that we've been through in the last 100 years. And there were 5 of them, and we didn't have to take any sort of special measures. They were all kind of variations on the H1N1 virus, which is the one that was behind the 1918 influenza pandemic. But at least we had a handle on it. We knew sort of what to do, and they never got to this level of severity. Here's a comparison, again, from the Center for Disease Control that shows the differences between the seasonal flu on the left and the coronavirus on the right. If you have the seasonal flu, chances are you're going to give that flu to 1.3 additional people. With COVID, if you have the coronavirus, you're probably going to give it to 2.5 additional people. So why the difference? Part of it is that the incubation time for the seasonal flu is only about 4 days. From the time you're exposed until you begin to have symptoms is about 4 days. With the coronavirus, the incubation period is 14 days. So for 14 days, you're still looking and feeling pretty healthy. You're going around and you're shedding virus. So if you go to the grocery store, if you go to an event, then you're exposing other people and you didn't even know that you had the virus at that point. So the chances that you're going to give it to more people is much greater. For the seasonal flu, only about 2% of the people who get the seasonal flu wind up in the hospital. They might have pneumonia or something like that. With COVID, 19% of the people who get the COVID virus are likely to wind up in the hospital, and about 1/4 of those may even need intensive care. So the fatality rate and the serious illness rate for this virus is much, much higher than we've seen with the seasonal flu. The speed of spread, and that means that we risk overwhelming our healthcare system. We need to make sure that we are not passing it to other people. Everybody should consider that they are affected, including you. So wash your hands, and do all those preventive things that you would normally do for the flu, only more so. And this chart, also from the CDC, shows the effects of the protective measures that we're doing. And why are we doing this to ourselves? It's to slow down the spread of the virus, to keep from overwhelming our hospital system. If you look at that high point curve, if we don't take these protective measures, it will spread very fast. Like we hear from Italy, the hospital system is totally overwhelmed. They don't have enough beds. They don't have enough healthcare providers. And we don't want to get to that point. We want to keep it within the range that our hospitals can deal with it. And also we want to give the doctors and the scientists time to figure it out so that they'll find better ways of dealing with this, and hopefully some treatments. And they're already on the path toward a vaccine, which they're hoping they will have for us in about a year. It takes about a year to do all the testing to make sure that it's okay to give it to everybody. But meanwhile, we can meanwhile we can stay safe and stay at home and make sure that we are continuing to be well.
Right. And a couple of other things. If you get the coronavirus now, you're going to be going into a hospital where the healthcare workers don't have enough personal protection equipment. And so the chances of them getting sick from you is much higher. And that's really a detriment. That's a horrible loss to the nation. Every one of those people who gets sick or dies, which is a possibility, takes away from our capability of dealing with this. So if you get sick in 2 months and everybody has enough masks and gowns and gloves, they're going to be able to take better care of you, and you're going to be safer. They're going to be safer. That's a big issue. Another thing is, if we overload the hospital system to the extent that has happened in other countries, there will be absolutely no medical care for anything else, no matter how urgent. Somebody has a heart attack. What are you going to do with them? You can't put them in a hospital with everybody being sick, and that's what they'll have to do.
Right, right. Yeah, so we want to make sure that everyone can stay safe. And we know that a lot of our listeners already have some underlying health conditions, which means that you're a little bit higher risk, because if you were to get the coronavirus, you're probably going to get a pretty severe case. And you not only have the coronavirus to deal with, you have your ordinary healthcare problems also to deal with. So it's very important that you stay well and hopefully stay out of the hospital.
Yes, in Colorado now they're asking anyone who has any kind of other underlying condition that makes them more susceptible, and everyone over the age of 70 not to leave the house at all, to have call on volunteer organizations, call on neighbors, get your groceries delivered either by people that you know or by companies. Don't leave the house.
Right. And here are some special ideas. So we want to protect ourselves from all viruses, from any person or anything that could carry the virus to you. You want to wash your hands, don't touch your face, and practice what we're calling social distancing, which doesn't mean isolate yourself. It means stay 6 feet away from another human being. But there are plenty of ways for us to stay in touch with one another, like, for example, the conferencing that Robin and I are doing this morning. She's in Colorado, I'm in Brookline, Massachusetts, but we're together over the internet. Avoid those droplets. Use your knuckles to open door handles, to push light switches, elevator buttons, things that other people are likely to have touched as well. If you put gas in your car, be sure to use either gloves or a paper towel. Paper towels are usually available to wash your windshield, so you could reach for one of those. And again, wash your hands as soon as you have the opportunity. Use hand sanitizer if washing is not available. And again, think about what you're touching and what you might be carrying to your face. So touching the counter in the store, touching money, touching the steering wheel, the mail, as Robin mentioned, all those kinds of things. Masks and gloves are not a solution in themselves, but they can be handy in certain circumstances. Personally, I've been making masks for the local nursing homes and assisted living places that are near me.
Right. And about the social distancing, if you do go out of the house, you will find a lot of people are totally unaware of what's going on, and they'll walk right up to you. Don't feel shy about bellowing at them. Stay away! 6 feet, social distancing. Seriously. Otherwise, they will just continue to walk up, shake hands with you, cough in your face, whatever. So they just are not aware. And people with a problem, any kind of health problem, are generally pretty aware of this. So please do keep yourself safe and don't be shy about it.
Right, and you can help to raise the consciousness of your neighbors. They may not be taking it very seriously for themselves. I know the first few days when my community was asking everybody to stay home and practice social distancing, the young people were still going to the bars and having a good time, you know? So we would see them overflowing with people. That's really not smart for young people as well as older people, because even though we know where the higher risks are, everybody in every age is likely to contract the virus. And they're saying that of the people who are getting sick, they're seeing a lot of people in that 20 to 60 age range getting sick from this virus. So they are not immune to it. They are not likely to have a lesser case. There are people in the younger age groups who have been very seriously sick.
Yes, and we don't know what kind of lasting effect that's going to have on them if they recover. Are they going to have permanent lung damage? Are they going to have permanent brain damage, permanent heart damage? We don't know. It's not worth the risk.
Right. We don't have any of those long-term statistics yet, but none of us is immune to this. We do know that in general, the population just does not have innate defenses. So stay home, stay as home as much as you can. Use the telephone and the internet to stay connected with your friends and your family. Those social connections are important. So we do want you to stay connected, just don't touch each other. And we have a lot more internet options now available to us than we've ever had before. Imagine your grandparents doing this in 1918 with no telephone, no television, no internet, and all those kids were at home. So it was not so much fun. I put on this.
And people in 1918 didn't even know what caused their illness. So
Right.
they were just terrified of everything, and you can't blame them. But people literally just sealed themselves up in the houses. They wouldn't open the door for anyone. They didn't come out. People starved to death because they were sick at home and couldn't do anything.
Right. So at least we have channels for deliveries. Communities are putting together resources for the people who live within the community. And my community also has a web page where they post where's the need the greatest, the needs with the food banks, for example, and the hourly workers who are not getting paid and therefore are having trouble with their rent. So those are compelling needs. There are hotlines that you can call. So here are the authoritative places to find information about what's going on. The Center for Disease Control, cdc.gov, has a lot of excellent information out there. The World Health Organization, WHO.int, that's the authority for the world. And then look to your local resources. My local resources is brooklinema.gov, and they also have information about just how many confirmed cases there are in our community and who you can call if you need either medical assistance or non-medical assistance. What if you're in an abusive environment? Who can help you? And I also want to remind everybody that Robin is there at smartpatients.com. Oh, it has an S on the end, I think.
Yeah,
right?
we need to remember that S.
Sorry, it should have an S on the end, smartpatientsplural.com. And if you sign up for a free account there, you can see their whole discussion about the coronavirus. And the other thing I wanted to underscore is don't forward anything in Facebook unless you're really sure that it's really true, because there's a tremendous amount of disinformation and bad information out there. And there are hoax checking sites. So if you look for one, Snopes.com, we refer to Snopes quite a bit, but the hoax checking sites are there to verify and make sure that the information is correct.
Right. And don't just believe an attribution like this is from Stanford, this is from the CDC. If you don't see it on their website, don't believe it.
Right. One of the attributes of a good hoax is name dropping, you know.
Right.
So they'll say somebody in authority said, or some hospital in authority says, and just because they said that doesn't mean it's true. It's just that they're name dropping to give it more credibility.
Exactly.
And Robin is out there with her team of good folks helping people with specific condition information too. And one of the things we wanted to point out is that some of the drugs that seem to be helping in treating the coronavirus are drugs that are already being used for other rare conditions. Robin, you want to talk about that?
We've heard a lot about chloroquine and hydroxychloroquine. These are not as helpful in reality as they've been touted. The test that was done in France was a very, very small test, and it was very badly carried out. So really any evidence that we have for this is on the level of anecdotal evidence. Hydroxychloroquine, if you get sick, might help, but probably won't. So please don't go out and buy it, because there are people who have autoimmune conditions whose lives depend on being able to get that. And already some of them are being told, we're sorry for your sacrifice, but we're not going to be able to give you that anymore. And that's really scary to people who are who know how sick they can get without their medication. We're also hearing about antivirals, for example, ones that have been used on HIV, and they are not proven yet. Unfortunately, they may work, they may not work. So don't count on being treated. There are people who go into the ICU and they get 8 drugs, and they get intubated, and they get ventilated, and they're fed through their veins, and they have 6 IVs going at once, and they may get better, they may not. We can't predict. So the best thing to do is don't get sick.
Yes, don't get sick, and don't self-medicate. As Robin just said, we don't know anything that could be a preventive, but some of these things could moderate the disease for people who are already sick. So the doctors will know if you need that kind of a drug. They will prescribe it, and hopefully they'll be able to get it. But it's important that we don't self-medicate or don't try to buy it on the black market or anything. It's not worth the risk, and it could be depriving someone of a life-saving treatment.
A couple made themselves very sick by taking what they thought was a drug. It was not it had the same name, but it's not the drug, and the husband died. So don't self-medicate.
Right. So stay well out there, everybody. We are here for you. And if you have any questions, you can always send them to info@powerfulpatient.org, and one of us will get back to you.
Join the website and ask on the website. If you email us, it only goes to the staff. You want to be talking to the other members. And if you have an underlying condition, talk to those members, because they will have ideas about the coronavirus with your specific underlying condition.
Right, smartpatients.com, and sign up for that free account and pose your questions there to the community, particularly if you have a rare condition. There are people with your condition who can advise you and give you some perspective on the issue. So stay well, don't panic, and hopefully we'll all get through this, but we can't end it on a schedule. I just read an article this morning about Hong Kong, which was being touted as one of the best controlled areas, and they ended their isolation, they ended their social distancing too soon, and now they're having a resurgence. So we have to, as Dr. Fauci said this morning, the virus will set the schedule. We cannot call the schedule. The virus is going to call the schedule, and we just need to follow through and stay well. Okay?
And be a powerful patient.
Be a powerful patient. Thank you so much for joining us, and we'll talk to you again sometime. Thank you. Bye.